Hi, everybody. So glad you can join me. And just so you know, this is being recorded and it will go on my website, and we'll talk about that too. So ear fitness is part of the head to toe fitness series. And I learned so much more about the ears that I want to share with you. So first of all, I'm going to break it down into the two main functions, and those are hearing and balance. And we're going to talk about alterations in hearing and balance, or distortions, and how hopefully I'll simplify hearing issues, but also balance issues, and make it very easy to remember. And then also share with you the main pieces that tend to affect our hearing and balance, or our ears. And that's infection, brain, medications. I'm also going to talk about chiropractic adjustments because those are very important as well. So let's get started. So first of all, I just want to say this isn't necessarily the opinion of Standard Process or Medi-Herb. Anything I'm telling you has not been evaluated by the FDA. Hopefully I'm not coming across as claiming to treat anything. And I will tell you that all of the research is what I've done on my own, and I do stand behind all of it. So let's get started. So the two functions that our ears are supposed to do is hearing and balance. So what happens when our ears aren't living up to our normal expectations? Well, we have distortions in hearing. So the distortions in hearing could be overly sensitive to noises that normally wouldn't bother anyone else, or it could be that we're just not hearing well. And then the distortion of hearing can also be buzzing in our ears, ringing in our ears, whistling noises. These are all the hallmark symptoms of tinnitus. And then balance is the other main function of our ears. And what happens when things go wrong with the balance portion of our ears is a loss of balance. So that can be all the hallmark symptoms of vertigo or Meniere's disease, such as unsteadiness or spinning. Nausea would be another hallmark symptom. So first of all, what I want to do is just give you the basics of our ear function to help you understand how we hear and how we balance ourselves with the help of our ears. So our outer ear collects sound waves and channels them into the ear canal. And here the eardrum vibrates, which helps amplify the sound. So we'll talk a little bit more about the eardrum, but also I want to tell you that part of this whole process has to do with the hair cells within the ear. They help transport these sound waves. And then the eardrum actually beats against these sound waves, and it makes them stronger. And then these sound waves are transformed or converted into electrical impulses that are sent to the 8th cranial nerve, and then eventually to the brain. Excuse me, just for a minute. And then as far as balance, so the 8th cranial nerve transmits these impulses to the brain. And then the brain is responsible for interpreting all of the sensory information. So it's coming not only from the hair cells within our ear and the eardrum, but also our eyes are going to help be part of this input to the sensory information to our brain. And then ultimately, the brain takes all of these senses and translates it into coordination, balance, and movement. If these incoming signals are thrown off, you experience a loss of balance and distortion of hearing or balance. So hearing is very important for personal joy. There are so many amazing sounds to listen to, but also for our personal safety. Sometimes we will more than likely hear a potential threat to our safety long before it becomes visible. So obviously hearing and balance are very important. So let's talk about balance. We have a collection of semicircular ducts and two tiny little sacs. They're called otolith organs that make up our vestibular system. Now, this I found fascinating. We have inside of our vestibular system, we have a gel, which I'll talk about in the next slide, but it acts as a miniature gyroscope. And gyroscopes are present everywhere in our daily life without our awareness. So for instance, our cell phones have a gyroscope. How often do we use our cell phone and we're putting it in every which way and it rights itself? That is a gyroscope. Airplanes use it and big cruise ships. And I thought this was interesting. The gyroscopes on big cruise ships are known as gyrostabilizers or stabilizers. And what they do is they reduce the rolling and imbalance of a ship at sea, kind of similar to how it might be with vertigo or Meniere's. Just keep that in mind. When the waves cause the ship to roll, the motion automatically activates the gyrostabilizers to right and steady the ship. So this is it. Our internal gyroscope is a gel. It's called endolymph that's inside of our vestibular system. And it acts like the tiny little bubbles inside of a carpenter's level. How often do we use this when we're hanging a picture? Want to make sure that it's level, okay? So this endolymph inside of our vestibular system helps with up, down, side to side, turning in any direction and tilting. What happens is when we get older, that endolymph thickens up and it makes it harder for our internal gyroscope to work. Okay, so we've talked about balance. Let's talk about hearing. So we're going back to the first major function of our ears, and we're going to talk about one of the huge factors that will alter or distort our hearing. And it makes sense because from the time that we're children, next to the common cold, ear infection is the most common pediatric illness, and it's the cause of temporary hearing loss. It's usually bacterial or viral induced. And with bacteria, it's usually staph or strep, and virus, it can be the measles and the mumps, which are common with children, but also hepatitis C, which is going to be certainly common with adults. And we'll talk about hepatitis C a little bit later too. So once it's in our ear, first of all, I want to tell you our first line of defense, which I think is fascinating, is our earwax. It's antibacterial. So if infection gets past our earwax, it doesn't just sit there in our ear canal. It needs something to eat on so that it can multiply. And unfortunately, it chooses all of those very delicate, very tiny bones, joints, wisps of cartilage that are inside of our ear, even our eardrum. So what happens if our eardrum has been attacked by some type of infection? It may heal itself, but it may do so with scar tissue. And once that eardrum has developed scar tissue, it can't vibrate like it's supposed to make that sound amplified. So here's another example of hearing an infection. Conductive hearing loss, which means muffled sound or hard to hear soft sounds, can be brought on by chronic ear infections. Simply put, the sound waves don't reach the inner ear with enough intensity. Viral infections, we talked about this, that most often affect the hearing are hepatitis C, measles, and mumps. Now, I learned about hearing when I did my webinar on arthritis and joint health, and that is available on kimsperryconsulting.com. If you look under resources, I'll go into more detail on arthritis, because I thought this was interesting that there's a growing awareness that hearing loss is more common in people with rheumatoid arthritis and other types of inflammatory arthritis such as psoriatic arthritis and gout. And what I want to postulate to all of you is think of all kinds of arthritis, including osteoarthritis, as some form of infectious arthritis. And again, I go into much more detail on that particular webinar. So here's an interesting comment. The inflammation of the blood vessels, which is a serious complication of rheumatoid arthritis, can damage the hair cells' ability. Remember, saying hair cells, eardrum, those are important to get that sound information to the 8th cranial nerve. So rheumatoid arthritis damages the hair cells' ability to send information to this auditory nerve and the brain. Rheumatoid nodules develop in the ears and interfere with hearing. Clusters of antibodies and antigens are overproduced in rheumatoid arthritis, and deposits of these clusters on hair cells of the inner ear can destroy the cells. Okay, so we've talked about hearing and infection. Now I'm going to talk about balance, the other major function of the ears, balance and infection. So if the inner ear becomes infected, the vestibular nerve, the 8th cranial nerve, swells, and the signals to the brain are thrown off and result in vertigo, dizziness, nausea, and loss of balance. So it's anything can happen along the way to the inner ear and then along the way to the brain. And if any of those signals are thrown off, you're going to end up with a distortion of hearing or balance. Vestibular Neurotitis, which is severe vertigo, is an infection of the inner ear that causes dizziness and loss of balance. It can happen when the vestibular nerve in the inner ear is infected or inflamed due to a virus such as the flu. So I wanted to share with you too, bacteria and viruses are usually the two most common contaminants in our ear, but we can also develop fungal infections and in rare cases even have parasites in the ear. Proposed theories of Meniere's disease causation include viral infections and immune system mediated mechanisms. The immune response in Meniere's disease is focused on inner ear antigens. Again, I'm just setting up the case for why infection is a huge part of any ear issue. Approximately 1/3 of Meniere's disease cases seem to be an autoimmune origin. And what we've learned over the years is that many autoimmune diseases come from infection that has never been managed properly. These are some of the studies, the clinical studies. Okay, so now hopefully I've established that infection definitely needs to be ruled out when you're dealing with any kind of distortion in hearing or balance. And again, remember, the viruses and bacteria are the two most common, but it can also be fungal or parasites. Now, we have a lot of fantastic herbal products available, and I'm happy to share with you after our webinar or even during the webinar in the chat box. We can talk about other products as well. But I chose Artemisinin Complex, and it's something that I started taking after doing research on it. So I actually take 6 a day myself. I chose this particular product because all the products that I'm recommending are going to be safe to use for just about anybody. They can safely be taken with medication, and there don't seem to be a lot of side effects associated with it. In turn, Artemisinin Complex carries the broad spectrum of support, immune system support, being antiviral, antifungal, antibacterial, and antiparasitic. So here's 2 clinical studies. So one was published in the Proceedings of the National Academy of Sciences, and the other is the Case Western Reserve study. And I thought this was interesting. So this is going back to hearing and saying that the ability to hear depends on proteins to reach the outer membrane of sensory cells in the inner ear. And in certain types of hereditary hearing loss, mutations in the protein prevent it from reaching these membranes. And at the National Academy of Sciences, they found that the classic anti-malarial drug, which comes from artemisinin, helps sensory cells of the inner ear recognize and transport an essential protein to specialized membranes using established pathways within the cell. Wow. And then the Case Western Reserve study, just so you know, this particular university is considered one of the top private universities in the United States. And what they did in their hearing clinical study is they genetically engineered zebrafish to have human versions of this essential hearing protein. And they found the same thing, that artemisinin restores inner ear sensory cell function. Very, very important. Now, artemisinin, in addition to being great for the ears, happens to be fantastic in, should say, very successful in the treatment of other issues, including allergies, arthritis. I talk about artemisinin in detail on my arthritis webinar. All inflammatory conditions, including ulcers. There are clinical studies showing that it kills H. pylori, which is great. Receding gum lines or periodontal disease. Receding gum lines, one of the major contributing factors is periodontal disease, and artemisinin is excellent support for periodontal disease. Lyme disease, HPV, and cervical dysplasia. And by the way, and I talk about this in my arthritis webinar on kimsburyconsulting.com, all sexually transmitted diseases are shown to be associated with arthritis, especially rheumatoid arthritis. And here we go, hepatitis. So remember I was saying the virus that's most commonly affecting the inner ear is hepatitis C. There are clinical studies that are showing artemisinin is excellent to use with hepatitis. And here's the safety. Even in the high doses prescribed, artemisinin and its derivatives are regarded as quite safe. No serious adverse events or toxicity are reported from clinical trials. Artemisinin, when prescribed for malaria, is contraindicated in pregnancy during the first trimester. Well, it turns out that we suggest that most women in their first trimester avoid any herbs to begin with anyway. So it doesn't make it any less safe than any other herbs. And artemisinin and its derivatives have been successful with pediatric infection disease. So here it's been used, the artemisinin drugs and analogs, as well as the herb, have been used for children as well. The only people other than first trimester of pregnancy that we recommend avoiding is anyone who is allergic to the artemisinin species. So if you know that you're allergic to mugwort, wormwood, or tarragon, I wouldn't take the artemisinin. And it can be used successfully with multiple medications. Suggested use for an average 120-pound adult or over the age of 12, 4 to 6 daily. 1 week on and 1 week off is recommended for at least 3 months. Carrie Bone recommends 1 week on and 1 week off just because the liver is very good at conjugating it out of the system. But if you do it 1 week on and 1 week off, it doesn't give it a chance to do that. And it also makes it very, very reasonably priced for anyone who's on this program. I'm taking 6-day and I feel wonderful taking Artemisinin Complex. So 4 to 6 daily, 1 week on and 1 week off for at least 3 months. And this is critical. Resolution isn't complete without at least a 3-month program. How many of us from the time we were children were either put on antibiotics for maybe a week or two, or even if we were on something that was alternative, most of us have not been on something to help resolve contamination or infection longer than 3 months, and that's critical. And amounts needed depend on the severity of the case and weight of the adult. In all of the clinical studies that I've done on arthritis, the equivalent of up to 16 tablets a day are used for very severe cases of arthritis, such as rheumatoid arthritis. Now, I mentioned sinus infection in here too, because sinus infections are very commonly associated with hearing issues and balance issues because of the eustachian tube. Mucus builds up in the eustachian tube. So if someone has a history, it doesn't matter how old the history is, of sinus infection, sinusitis, sinus headaches, my recommendation would be to add 4 daily of the Sinus Forte. This particular one you would take every day, along with 4 to 6 daily of the Artemisinin Complex. This one, again, still is 1 week on and 1 week off, and you do those combined for at least 3 months. Sinusitis vertigo is vertigo that's caused by a buildup of mucus in the eustachian tube. The eustachian tube runs from the inner ear to your throat, and it's part of the system that helps you maintain your balance, part of your internal gyroscope. When your sinuses are inflamed during a sinus infection, your sinuses are no longer draining properly. As a result, mucus and fluid buildup in many areas of the ear, nose, and throat, including the eustachian tube. Okay, so now we're going to talk about traumatic brain injury. And here's a PubMed clinical case, and I can tell you from personal experience, I know about traumatic brain injury and I know about hearing issues. So hearing loss is often associated with traumatic brain injury, either because it causes damage to the inner ear or the part of the brain that processes sound. And that is because our cranial nerves, and especially the 8th cranial nerve that we've been talking about, are vulnerable during head trauma because many of them run over the surface of the skull and are only protected by the muscles and tissues of the face. So penetrating, scraping, and shearing injuries can stretch, rupture, or cut across a cranial nerve. And broken facial and skull bones can also damage the nerves. So I want you to think of traumatic brain injury as a much larger umbrella than just hitting your head like I did 10 years ago. This is going to include any kind of concussion or loss of consciousness, not just from being in an automobile accident or and having a whiplash, but I call it chemical concussions, and that means drug or alcohol induced. So again, it doesn't matter how many years ago, if you've had a loss of consciousness from drug or alcohol, consider that as part of the traumatic brain injury umbrella. Encephalitis is inflammation of the brain, usually brought on by a virus. And birth or childhood trauma tend to be overlooked, but that is critical and very important to put under the umbrella of traumatic brain injury. So severe injury can cause damage to the nerves, as we've already mentioned, loss of blood flow and muscle issues that result in the perception of tinnitus or tinnitus. Black cumin seeds. So here's another herb that's considered very safe. It's been used for 2,000 years, very highly regarded. And this is interesting because it's neuroprotective. Remember that our nervous system is very important when dealing with hearing and balance. And black cumin or Nigella sativa is used in lots of clinical studies for Parkinson's disease, which is the most common movement disorder in population. And balance is going to be a really big issue with Parkinson's patients. Here we go, 8th cranial nerve. Remember, that's the biggest piece with our ear, part of our vestibular system. For decades, it's been speculated that Parkinson's disease is associated with the dysfunction of the vestibular system, especially given that postural instability, that loss of balance, is one of the major symptoms of the disorder. In the last few years, a number of studies have been published which demonstrate that the neuropathology associated with Parkinson's disease is present in the central vestibular system. Now, this is a study, this is a case study, a case report for the treatment of Meniere's disease with Persian medicine. And one of the herbs that they used in this case study is Nigella sativa. They call it phlegm, just so you know. This is done by the School of Persian Medicine, and the School of Persian Medicine is located in Tehran, Iran, established in 2007. And they established these were meant, this is for complementary medicine. When traditional medicine isn't working, they refer to this particular school. And this is for postgraduate students at the PhD level in Persian medicine and pharmacy. So this patient, so this is only one case, and I realize this is only one case, but I wanted to share it with you because I thought it was really interesting. This is a 40-year-old woman with Meniere's disease who was advised to consume, these were two medications that were used traditionally for vertigo and Meniere's disease, and nausea, because she had constant nausea. But due to the lack of satisfactory response to treatment, she was referred to this Persian medicine clinic. Now, this is someone who initially the drugs had worked and then they stopped working. So it mentions here, it stopped, it reduced the symptoms for a short period of time, but then despite continuing the drugs, the disease recurred. Due to a lack of satisfactory response, the patient was referred. In her first visit, the patient stated that her vertigo attacks occurred 2 to 3 times a week and lasted 24 hours. I just can't imagine that. That would be horrible. During this period, the patient didn't have good balance in walking, obviously, and vertigo was felt even when she closed her eyes. She also had headache, heavy head feeling, left ear tinnitus, nausea, and vomiting. Of course. So, among other things such as lifestyle modification, warming her body, enhancing digestive system, helping with defecation, as I mentioned, and removal of waste materials and accumulated humors from the body, especially from the head, they used black cumin. And if you read that study in detail, again, it's called phlegm. And what their conclusion was that the positive effects in the black cumin on the treatment of vertigo, sinusitis, and postnasal discharge are expressed in numerous articles. So while conventional medicine treatment was not associated with the appropriate response, Persian medicine was successful. It is hoped that this case will provide a basis for further studies on the impact of Persian medicine. And again, you can read how well she did. I don't want to say anything that comes across as diagnosing or treating. So here's another clinical study on black cumin seed or Nigella in regards to acoustic trauma. So acoustic trauma can come from our hearing being damaged by noises that are just too loud. And the aim of the study was to check black cumin seed oil in acoustic trauma, and they found very positive effects. And here's the clinical study. Now, they mentioned the oil, but it turns out that the seed is the source of the oil, and the seed is actually considered far superior to the oil versions of Nigella that are on the market, because you need that active ingredient, and that active ingredient is where all of the studies are done for developing a pharmaceutical based on Nigella. In addition, Nigella oil doesn't have all of the beneficial phytochemicals that the seed has. It's just an essential fatty acid part of the seed, and allergic reactions tend to be more common. Now, in the clinical studies, you only needed 2 grams of Nigella, and that's equal to 1 tablet daily. More may be used depending on the individual circumstances. Again, black cumin seed tends to be a very versatile product. So in addition to being fabulous brain and neurological support, it has been shown to be successful in the treatment of other issues, including addictions, allergies, autoimmune, especially Hashimoto's, and histamine intolerance, and then nervous system degeneration and toxicity. I've got lots of clinical studies that I can share with you if anyone's interested. So the use of illicit stimulants, methamphetamine, cocaine, and ecstasy cause neurotoxicity. Now, I put this study in here because toluene is a poison to our nervous system, and they found when rats were exposed to this toluene for months, it caused severe degenerative changes that destroyed neurons in the brainstem and the frontal cortex. And in the group of rats that were exposed to the same amount of toxin and the same amount of time, but treated once daily orally with Nigella, no pathological changes in the nerve cells were detected. That is amazing to me. Now here's black cumin seed forte and balance. So Meniere's disease is one of the most common inner ear and vestibular disorders. And this was the Persian study I was talking about earlier. Here's another Persian study, the effects of Nigella sativa on hepatitis C. Recall that hepatitis C is the one virus that seems to attack our ears more than any of the others. And here are the results and conclusion on using with hepatitis C. Significantly improved HCV viral load. The conclusion is that Nigella sativa administration in patients with HCV hepatitis C virus was tolerable, safe, decreased viral load, and improved oxidative stress, clinical condition, and glycemic control in diabetic patients. And of course, you probably remember that there's another product that Meniere makes called Metabol Complex, and it has a small amount of black cumin seed in it. But this is 4 times the strength, and this is the one that I would recommend. So normally just 1 tablet daily is recommended. And the other piece that I want to share with you too is that there are different ways to extract herbs, including black cumin. But Meniere guarantees cold extraction from ethanol alcohol. Ethanol alcohol is not to be confused with methanol or acetate. Those are the most common causes of extracting herbs, and they contain toxins in their own and are even flammable. Meniere guarantees no toxins because not only do they get the very highest quality from ethanol alcohol, but then they do their own independent study to make sure, lab analysis, to make sure that there are no toxins in those herbs. So the low toxicity of Nigella, let's see. Oh, so these are the active ingredients that are found in Nigella, possess remarkable activities, and again, a wide margin of safety for therapeutic doses. So even if you take more than one tablet daily, very safe to take. I can't go without mentioning Neurotrophin Pmg, which is a gluten-free product. I would highly recommend it for anyone. It's a product that I still take from time to time whenever I have sensitivity to noise. Neurotrophin Pmg is usually in my cupboard. It's better to take on an empty stomach. It's not vegetarian, so if you're vegetarian, I have another product that I'd recommend I'll talk about. But let me just share a couple of little pieces on Neurotrophin Pmg. Again, the neurotrophins, a family of protein growth factors, are prime candidates for molecular mediators of neuronal plasticity. Again, anything that's going to help our nervous system and our nervous neurons is going to be very important. Neurotrophin Pmg, as well as any of the other protomorphogens, are designed to neutralize the circulating antibodies, thus contributing to the sustenance of cellular health. Take on an empty stomach, that's the way I do it. I usually put it by my bed or in the cupboard, and then I take it first thing in the morning. That way, it just seems to work a little bit better. It contains a specific, cell-specific nucleoprotein to normalize tissue function and accelerate cell repair. So in this particular case, this is nervous system and brain cell-specific nucleoprotein. And hearing degeneration occurs, at least in part, as a result of the loss of neurotrophic support, normally provided by the hair cells. Neurotrophic factors may even be used concurrently with stem cell therapy to enhance survival and differentiation for the replacement of damaged or destroyed hair cells. Cranial nerve 8, the vestibular cochlear nerve we've been talking about a lot today, goes to the middle portion of the brainstem called the pons, which is then composed of fibers going to the cerebellum. So RNA is excellent. It's vegetarian support, and I recommend it as vegetarian support for any protomorphogen. So if for any reason you cannot take Neurotrophin Pmg, please consider ribonucleic acid by standard process. It is going to provide cerebellum support. And I'm going to talk a little bit more about RNA. So again, the cerebellum, the information processed in the cerebellum and the cerebral cortex of the brain allows the body to cope with changes in speed and direction in the head. Okay, that's part of the internal gyroscope. 6 tablets daily is what's normally recommended. And it turns out that brain diseases such as Alzheimer's and vascular dementia statistically show lowered RNA in patients. Neurosensorial aging is associated with a drop in the level of RNA. Again, very important for our nervous system. Just want to say a quick thing about really, really good high quality fish oil is important for the brain, and especially products that contain DHA. So I'm mentioning here Ulprima EPA DHA. Another favorite, I keep it in my refrigerator, is calamari oil, which is an excellent source of DHA. But DHA crosses the blood-brain barrier and is going to provide ready-to-use fatty acids for our brain. And very important to keep that DHA high. And how you can do it, if you want to find out your levels of your essential fatty acids, there is a blood spot test available on our Standard Process website. If you just go to standardprocess.com in the little search bar, you have to sign in first, otherwise it won't show up. Just type in omega-3 index plus, and it will give you information on this blood spot test. It's used in over 200 research studies, very easy to understand, and it provides information on your omega-3 to omega-6 ratio, arachidonic acid to EPA ratio, and trans fat index, in addition to your omega-3 status. Okay, I don't want to go without acknowledging how important it is to take care of any patients with hearing or balance issues with chiropractic care. And I thought this was great because I found a clinical study showing how important this is. So here's a 40-year-old woman presented with Meniere's disease and vertigo, and the symptoms included left-sided neck pain, temporomandibular joint pain. So I understand that TMJ is also going to be very important to look at. And examination revealed a left-sided upper cervical joint dysfunction. So this is explaining the therapy, the chiropractic therapy that was done. Within 2 weeks of treatment, the patient's tinnitus had resolved and all other symptoms, including vertigo, were improved. Very, very important to make sure that you get chiropractic care. The conclusion of this clinical study suggests that chiropractic care, including upper cervical spinal manipulation and soft tissue therapy, may be beneficial in treating some patients with Meniere's disease. And again, I would say that that would be also excellent for any hearing and balance issues. Lastly, medications are related to hearing loss, and this is something also to rule out with any hearing or balance disorders. There are over 200 medications that are linked to hearing loss and balance disorders. They are antibiotics, anticonvulsants, and pain relievers. Oh boy. Okay, so please keep that in mind and share that in your conversation with your patients. And that is it. So again, this recording will eventually be available, I'm guessing, within the next week or so at kimsburyconsulting.com. You just go to resources and you can look for webinars. And I will continue to put my own research on any topics up there. And I'm so happy that you were all here to join me, and I'm available for any questions.
Wow, thank you so much, Kim. We do have some questions.
Okay.
Number one question is, when you're pairing up the sinus fort, are you doing that 1 week on, 1 week off as well with the artemisinin?
You take that every day.
Okay,
for at least 3 months.
That's what we thought. Okay, 3 months. All right, everybody get that? And then let's see here. Are those all the actual questions? Oh no, yes, sorry. Dr. Peter Beauregard has a question for you. If you could talk a little bit about the differences between Neurotrophin Pmg versus Neuroplex.
Sure. So any protomorphogen is going to help with the antibodies, and in this particular case, the anti-brain antibodies. So anytime you have an injury, antibodies may be a reaction of the body, a protective reaction of the body. But if you have those in the system, in the bloodstream too long, the body, the immune system will go after the organ and attack it. So you can end up with autoimmune disease, in this particular case of the brain. So it's my understanding of protomorphogens, as I think of them as plasmapheresis for the blood, and in this particular case, helping to remove the anti-brain antibodies. So you can use them in conjunction with one another, or you can take them one at a time. So anytime someone's had a brain injury, I would definitely start with Neurotrophin Pmg. And again, I think it's better on an empty stomach. The Neuroplex is a fabulous brain product and is going to be excellent support for anyone with seizures, anyone with loss of focus. I would automatically add Neuroplex as brain support after you've been on Neuroplex for a few months. And Peter, if you'd like, I can email you additional information on Neuroplex. Actually, if you go on my website, I believe if you just type in Neuroplex under the search bar, you'll find some really cool success stories on there. But again, if you need more information, I'm happy to get that for you.
So neurotrophin, you'd say, for the beginning part of
traumatic brain injury.
And then put in Neuroplex
afterwards, yes. And it doesn't matter how old the traumatic brain injury is, even going back to childhood, that should always be addressed if it hasn't been.
Yeah. And then also, he says that, in case you have a comment about this, Lee Carroll said that the Nigella has melatonin in the seed coat and that grinding it makes it bioavailable. Have you heard this?
I have never heard that before, but that's interesting. Right? You said the seed coat?
That's what he says.
Okay.
That's what he says that Lee Carroll says.
Okay. Well, I'll tell you, Chase Tree by Meniere is an excellent, that helps the body make its own melatonin as well. But that would be very interesting to find out. Nigella has so many different functions. It's a fantastic nervous system and brain product.
Yeah, I have to say that I, sort of threw the book at my daughter's brand new, just sprouted out allergies. And the thing that tipped the balance, even past the heroic dose of Allerplex, was I gave her one black cumin seed fort. She actually texted me and said, "Thank you. I feel much better." When did she do that, right?
Oh, well, yes, that is a wonderful product. In fact, I have some practitioners that are using that for all autoimmune disease, not just Hashimoto's. And they said it actually works more effectively than some of the other products, such as the Artemisinin Complex by Meniere.
Yeah. Okay, another question, whether or not Neviton would be helpful for TBI?
Yes, it's funny. I thought about mentioning Neviton because of the saffron. There are clinical studies showing that saffron is very good for the brain too, and the nervous system. But again, if it's a TBI, and I'm talking from personal experience, because I had a very severe traumatic brain injury 10 years ago. You've got to start with some of the basics, but yes, Neviton is a fantastic product, and it's one that I take at night, occasionally for sleeping.
Oh, nice. Oh, and Dr. Beauregard said that the black cumin seed grinding business came up in when they were talking about the turmeric flatbread, which if you guys haven't tried doing, it's so good. It's just really good. And you can make it without any gluten in case you're gluten-free. It's fantastic. Okay, does anybody else have any questions? You can unmute yourself if you have a question.
And I'm hoping that this was valuable information, not just helpful, but valuable. Just breaking it down and simplifying things, making it very easy to figure out which direction you need to take.
So it sounds to me like, this is sort of my question, that if it feels a little bit more viral, go on the artemisinin side. And if it feels a little bit more brain injury, black cumin seed fort.
Yes, but who hasn't had an infection or contaminant in their body at some point in their life, including childhood?
So would you get rid of the virus first?
I would recommend probably attacking both, depending on the severity, but very, very easy to do, considering only one black cumin seed forte and 4 to 6 Artemisinin Complex, 1 week on and 1 week off. It's a very easy program to do both at the same time.
True, that's a nice benefit to the black cumin seed.
Mm-hmm.
Makes
And
a
the
lot of
fact that
people
both
happy.
are so versatile.
Yeah. Anybody else care to unmute themselves so that they can ask a question? And then don't forget, if you think of something as soon as we go off the meeting, you can always get in touch with us later. It's totally fine. Gosh, thank you so much, Kim. This gave me a lot of food for thought. You know, as acupuncturists, you know, we're told in Chinese medicine that the ear is the outer expression and the of the kidneys. And sometimes these ancient ways of looking at things seem really random, but you know, you called to mind the bones in the ear, which bone tissue is under the auspices of the kidneys, and also the hair follicles. Head hair is under the auspices of the kidneys.
Oh,
So it's
interesting.
sort of, it gives credence to the thing that we often say, but sounds a little corny, ancient, old-fashioned, not relevant. And you just made it all relevant again.
Oh, good. I'm so glad. And the fact that contaminants, I don't want to keep using the word infection, actually get in there and eat those tiny little joints and bones and wisps of cartilage inside of our ears, and then that's not good.
No. And I should say that in our chat box here, there's a lot of good information about treatments.
Oh, wonderful.
Yeah.
Is there a way to save that?
Yeah. Well, you
Okay.
probably know everybody here. So Lee Morgan says osteopathy, right? Craniosacral work. That makes sense.
For sure.
Right?
Yes.
Given what we're doing. Peter Beauregard gave us another idea about a self-healing practice, an alternative to Epley's maneuver. Yeah, great information, everybody.
We learn from one another.
Right?
Yes.
And refer to each other.
Yes.
Right. Thank you so much, Kim. Really
you're
it.
so very welcome. Thank you, everybody, for being here.